And today we take a moment to celebrate and honor the remarkable dedication, compassion and resilience of nurses, the heartbeat of healthcare systems across the world. This year's global theme, Our Nurses, Our Future. Caring for nurses strengthens economies, reminds us that investing in the nursing profession is not only essential for better healthcare outcomes, but also for the broader development of our societies. Joining us now is Doctor Meghan Botes, who is Senior Lecturer at Wits University, to reflect on the role of nurses in our healthcare system and what it means to truly care for caregivers. Meghan, a very warm welcome and a happy Nurses Day to you too.
Thank you very much.
Right.
Thank you for having me.
Sure, only a pleasure. So let's start with a heartfelt thank you and start with just asking, what does this day mean to you personally, and how do you see it resonating with the nursing community as a whole?
Well, I think in a community where often our profession is underappreciated, and for various reasons, it's a wonderful day to celebrate the profession, to celebrate what the role of nurses mean to the health of our society. And for me personally, it's a day to say I'm proud to be a nurse. I love the profession, I love the career, and it's one of those days that we get to brag about the fact that we have this noble profession.
And of course, nurses have always been on the front lines, from primary care clinics to emergency rooms, and even during the darkest of times, case in point during the COVID pandemic. So what are some of the most under-recognized contributions nurses make to the healthcare system that the public should know about on this day?
Well, look, I think what's under-recognized is the role of the nurse in 24-hour care. We have a very unique position in that we are at the patient's bedside for the most amount of time. And that means that we get to know our patients better, we understand them better, we are able to connect better. And especially you talk about during COVID, that was a very important time when connection was the most important part, because people were isolated from their family members, and generally the nurse was the person who had the most connection with the patient. And I think that can sometimes be under-recognized, especially in the times where we're living in, where nurses are struggling in difficult conditions of service and the connection is not as easy to make anymore. But for me, that's the biggest contribution of the nurse, is that ability to care and connect with a patient like no other healthcare provider can.
And here's the thing, Doc, this year's theme links to the well-being of nurses to stronger economies. Can you perhaps unpack how investing in the nursing workforce translates into broader economic and health gains, particularly in the South African context?
Well, the majority of our healthcare workforce are nurses. And when we do not invest in that particular workforce, we see poorer outcomes. And poorer outcomes for patients means a bigger burden on the economy and on the fiscus, because it means you have sicker patients, you have patients who stay in hospital longer, and therefore that affects the economy. And then also in terms of education and training, research has shown that the higher the level of education of the nurse, the better the patient outcomes. And so if we're not investing in the education of our nurses, we're also going to see poorer outcomes for our healthcare system, and therefore it becomes a burden on the fiscus.
And we often speak about how overworked and underpaid nurses are. So what kind of policy or funding changes do you believe are urgently needed to truly care for nurses?
Well, I can't tell you exactly what the policy should look like, but what I do know is that who the policy makers should be. As the majority of the healthcare workforce, we have the least amount of say, the least amount of seats at the table, and so we don't get an opportunity to speak about what these policies should look like, how nurses should be remunerated and cared for in a way that makes sense to the nurse. Often policies are directed by medical doctors and other professionals, and that's fantastic. We need the expertise, but what's missing is the voice of the nurse. And if you bring the voice of the nurse into the policy table and into the process, you'll have policy that makes sense for the majority of the healthcare workforce.
And here's another problem, Doc. Many nurses leave the profession or migrate. So what do you think can be done to retain skilled nurses in South Africa and keep morale high? And also, how do we just go about, building or making those seats on the table?
So, it's an age-old discussion. Remuneration is a big part of it. We have skilled nurses sitting with degrees and specialized training who are not remunerated according to their skill level. And because of that, it's often that category of nurses, the degreed nurses, the nurses who are professional nurses, the nurses who have specialty training, it's those who are leaving because they end up sitting in the lower to middle class economy, whereas a highly skilled professional in another country would be remunerated accordingly. So yes, we talk about pay, and it is a noble profession, and nurses, it's always a dilemma when nurses are striking for pay, but the reality is that remuneration is a big part of making sure that nurses stay in the country. And the other thing is the working conditions. When you are working under conditions that are strenuous, where resources are short, where you feel helpless because you cannot deliver the best possible care, those are other reasons why nurses leave. And they become disillusioned and they become fatigued. And those are some of the reasons why they leave. And so if we start to look at remuneration and working conditions, those are only going to change through policy. And so what we need to be doing is when our president talks about the sad state of affairs and how nurses are leaving, we need to say to him to make room then. Make room for us in the ministry, in parliament, when you are developing policies, when they have those indabas for policies, how many nurses are represented. Those are the questions we need to be asking in order to answer the questions that you asking today.
And just lastly, Doc, what's your message to South Africans today, patients, policymakers, and even fellow healthcare professionals as we mark International Nurses Day?
I think in South Africa, unfortunately, we have many people in the public who have had negative experiences with nurses. And it can often paint a poor picture of the entire profession. And for today, I want us to pause and just remember two things. And these are not excuses for poor care, but just to understand some of these things. First of all, nurses are trained at different levels. And when we understand that, we understand what to expect from the different categories of nurses. And second of all, that there is a concept called compassion fatigue. When you are constantly facing the pushback from resources, when you are unable to manage the workload of patients in front of you, when you do not have the capacity in terms of resources or skills to deal with what's in front of you, you develop something called compassion fatigue. And nurses often experience this because of the helplessness of the circumstances in which they work. And maybe today, if we take a moment to appreciate, to encourage, and to speak out and advocate for nurses, we'll be able to change that narrative and have better experiences and nurses who can rekindle their passion and their love for the profession they chose in the first place.
Well, that was Dr. Meghan Botes at Wits University. Thanks very much indeed for your insights on the program.